a respiratory therapist by background, but now have been with the BC Patient Safety and Quality Council as a quality leader for the past year. And this session is the third in a series of webinars to support clinical care management for the prevention of venous thromboembolism. CCM is actually one of the largest quality improvement initiatives that we've ever undertaken in the province. So it's fairly exciting, and we've done a lot of work already. A lot of the health authorities are getting geared up to collect some data for quality improvement and to make some changes and make sure that we prevent venous thromboembolism throughout our province whenever we can. CCM, just to give you a little bit of background, is led by a steering committee that consists of representatives from the Ministry of Health as well as from our council and from all of the health authorities. So it's really a joint effort. So I just wanted to briefly introduce our presenters today. We have with us, first of all, Dr. David Wilton, who is our clinical leader with the BC Patient Safety and Quality Council. And we have two great presenters from some of the health authorities. We have Christine Jareth. Christine has been nursing for over 20 years, and her experience includes acute medicine, cardiac sciences, ICU, and post-anesthetic care. And at present, she's the clinical nurse educator for the post-anesthetic care unit and high acuity unit at St. Paul's Hospital, and also the PACU surgical daycare and endoscopy suite at Mount St. Joseph's Hospital. Christine's also the project lead for the Providence Healthcare's VTE Prophylaxis project. So welcome, Christine. We also have with us Jennifer Stida, who's a quality improvement consultant for the Interior Health Authority. Her office is in Kamloops, and her background's in teaching and kinesiology. She's recently completed a master's degree in educational technology, and as part of her job at Interior Health, she develops online learning modules for quality improvement topics, including one that she has developed on VTE prophylaxis. And so later in the call, we're going to have Jennifer hopefully show us what she's developed up there. And before I hand it over to our speakers, I just wanted to get a sense of who's on the call with us today. So I can see that we've got quite a few people joined. Take note that your audio line will be muted for most of the call, but when you raise your hand to ask a question, we'll make sure that we unmute you so that you can speak. Or you can type your question into the chat feature, which I'll go over in a moment. So if you could look at the top of your screen, on the top left-hand side, you'll see a pointer, a little arrow. So click once on that pointer, and you can move that around on the screen as you click, and give us an indication of where you're joining us from today. So I can see, it looks like we've got someone from Kelowna, so we've got, and Jennifer from Kamloops. We've got someone from Fraser Health Authority. It looks like Vancouver Coastal is well represented. Anybody from Northern Health Authority today? Or from Vancouver Island? Okay, good. Okay, so if you click a second time on that poster, your pointer will disappear. So there's two ways to ask a question today. One way is to raise your virtual hand, and if you look just under the list of participants on the right-hand side of your screen, you'll see a little hand icon. So click once on that hand icon, and you'll be able to raise your virtual hand. And that's a good way to stop our presenters when they're talking and ask a question. Sometimes we have audio noise through the headsets if you're talking through your computer. So a better way to ask a question might be by typing it into the chat feature. So below the list of participants, you will see a chat feature. And if you see the box at the bottom, I'm just going to type something in now. You will be able to type your question in there and then send to, and then select all participants. You'll see that I've done that there. So feel free at any time when our presenters are talking to type a question in there, send to all participants, and then they'll be able to stop at the end of their talk and answer that. And I just got a chat message from someone who says that they're joining from Alberta, so welcome, and I'm hoping that you'll find something that will apply to your hospital as well. So some of the objectives that we are covering today, the first is to understand the rationale for providing VTE education for healthcare professionals. We're going to hear some examples of how 2 of our local health authorities are approaching the challenge of VTE education. And we'll have an opportunity to ask questions and discuss the challenges that your own site is facing with providing education to healthcare professionals. And I'm sure that many of you on the call today know that Accreditation Canada has recently made VTE education for health professionals one of their required organizational practices for VTE, which gives us some motivation to work on that. But I think that there's a larger indication for doing this, and maybe I'll turn briefly to Dr. David Wilton just to ask you, David, from a clinical perspective, why is it important to educate health professionals about VTE risks and prophylaxis?
Thanks, Shari. First of all, I'd like to thank everybody for taking the time to join us, and thank our presenters. I'm looking forward to actually seeing their work and learning something about the educational process that's happening in the province. VTE prevention is, by its nature, multidisciplinary. As everybody knows, it involves physicians and pharmacists and nursing staff to carry out the orders, and also allied health professionals. So if we're looking at achieving sustainable results, clearly we need to take a multifaceted approach to this. The studies clearly show that one-dimensional approaches to improve VT prophylaxis, such as introducing guidelines and just sort of dumping them on physicians, doesn't work, and it's not sustainable. So we need to use education, awareness, measurement and auditing strategies, feedback strategies in a multifaceted approach in order to achieve sustainable success. And some of the major barriers that we find to achieving our goals for VTE prophylaxis include a lack of awareness of the scope of the problem, an underestimation of VTE risk for individual patients, and overestimations of the bleeding risk. And many of these barriers can be dealt with education and awareness of both healthcare providers as well as patients. Speaking specifically to the nursing role, which I think will be covered in some of the talks, clearly there are technical aspects to administering pharmacologic and mechanical prophylaxis. Mechanical prophylaxis poses particular challenges because sometimes it's not as easy as one might think technically to use it properly and to keep those devices on patients 24 hours a day is quite a challenge. So nursing clearly needs to be aware of the technical aspects of prophylaxis, but beyond that, nurses and other allied health professionals often have the greatest situational awareness of patients. They're at the bedside involved with the patient, and in fact they're administering the intervention. So having them engaged and educated, it drastically improves compliance, and it also improves safety of the intervention. So there's many reasons why we should be educating and engaging with all healthcare providers as well as patients, and hopefully we'll hear some more about that in the next couple of talks.
Great, thanks, Dr. Wilt. So with that, I'm going to turn it right over to Christine Jareth, and she's going to talk about what she has set up for Providence Healthcare. Go ahead, Christine.
Afternoon, everybody. So what, as Shari mentioned earlier, I am a clinical nurse educator, and the reason that I became involved in this was that a lot of the OR and PACU staff asked me questions about how do we appropriately use mechanical prophylaxis, when do we put them on, how long do we put them on for, and so forth. So that really led what we do at Providence Healthcare. I'm just trying to get my slides here to work. Hold on here. There we go. So what the next steps after seeing that we wanted to address this was we wanted to raise awareness. So we went around, we talked to everybody and anybody to know what their knowledge base around this was. Then we also did a baseline audit as far as how often is VTE prophylaxis being given, who is it being given to, and so forth. So we had an understanding of what was going on within our organization. And then what we did is we gathered up institutional support from the Department of Surgery chair and so on and so forth. And then as the project continued along, we expanded that support. We developed a multidisciplinary team to help tackle the issues. We have pharmacy representation, nursing, physicians, and so on. And then we developed a plan of action. We developed a pre-printed order set and a policy that physicians could follow. And then through the process, we tried to knock down as many barriers as we could. We implemented education, and then we also implemented the pre-printed order set. So that was the process that we followed throughout this. So we took a three-pronged approach to our education. So we did an online module, which is accessible both from the intranet at the facilities as well as from the internet from home. We also did in-person in-services. They were both scheduled as well as roaming. And then we also provided information binders to all the units that were affected by VTE prophylaxis. So those were all our acute care inpatient settings. So this is the link to our online module, and I'll see if I can bring it up here for us. Okay, so this is what the module looks like, and I'm just going to have to move my screen down here. So what we did is we outlined what the objectives are for the learner, and that was to review VTE, present what the policy is, introduce the risk assessment tool that's specific to our facility, examine pharmacological thromboprophylaxis, review mechanical prophylaxis, and then present what the implementation plan for our organization is. Okay. So we went through, we described what is a VTE, the common types of VTE, why do VTEs form, who is at risk, what are other risk factors, what are the implications of VTE, what will PHC do to prevent VTE. So that included both our policy as well as the education and then the risk assessment tool and the pre-printed order set. Risk assessment tool, going through who exactly is responsible for completing that, and then giving a sample of it, a sample of the pre-printed order set, and then we talk about thromboprophylaxis in itself. So we go through that. In our organization, the first line is obviously pharmacological with the backup of mechanical if there are bleeding contraindications. Okay. And then we talk specifically about the pharmacological agents. So we chose to go with dalteparin as our primary drug, with heparin being our backup in the case of renal failure. And then we explained to the learner why did we choose low molecular weight heparin. And then we talk about the contraindications to thromboprophylaxis. And then we go through exactly what is dalteparin, how do we use it, what's the dosing. Then we go through a little bit of a video about how to give it. In some units within our facility, the safety device on the dalteparin is very different than what any other device that we have. So we went around and we showed that video as well as followed up within our in-person in-services. And then as Dr. Wilton mentioned, mechanical prophylaxis has a high user compliance factor to it, so we wanted to also emphasize that to our learners. So what we did is we went through and step-by-step provided slides on how to measure as well as apply the SCDs. So I'll just quickly go through these slides here. So it's showing the fitting, showing the sizing, and then the optimal application of SCDs. So again, step by step, and then also emphasizing the fact that anybody who has SCDs on, that appropriate skin assessment needs to be performed, and we outline exactly what they need to look for, and then how frequently that needs to be done. And we talk about the compliance, again, preferably 23 out of 24 hours a day. Okay. Review of the plan for implementation at Providence Healthcare, and then our go live date. And at the end of this, online module, we also have a certificate of completion as well as a quiz that people can complete. And as the owner of the presentation, I can then track who exactly has gone through the module, who has completed the quiz, and who has printed off their certificate. And we have also available to us patient education, and so if staff are wanting to use that, they have that at their disposal on all the units. Okay, and that was the first pronged approach to our VTE prophylaxis. Okay, and then I'm just having to search back here. Sorry.
So just go to the top where it says stop sharing.
Okay, I can't get back to that screen.
The very top, just move your mouse on the very top of your screen.
Okay.
You'll see a drop down, the very top, even farther up.
There we go. Okay, sorry.
Good.
There we go.
Back to their slides.
Okay. So the other approaches that we had were, as I mentioned, the in-person in-services. And what we did during those in-services were we showed people exactly how to measure and apply the SCDs. Then we had them return demonstrate that. We also brought along pre-filled saline syringes of the dalteparin syringe. We demonstrated that, as well as had people re-demonstrate that. And then for those who attended the in-person in-service before they attended or did the online module, we also highlighted some of the content from the online module. And then from our information binders, what we did is we provided learners with the information about the regional policy. We also put in samples of the pre-printed order set as well as the risk assessment tool. We put in the monograph for dalteparin. We also put in the facility information in regards to dalteparin, and then our facility policies around SCD use. Okay. Some of the challenges that we encountered, let me just see. Okay. Sorry, I'm having some sorry, this is my first time doing a webinar, so I'm a little bit inexperienced with this. I'm just going to go through my slides here, if I can get them to work.
So
there we go.
There you go. I'll help you advance the slides if I need to.
Okay. Okay. So some of the challenges that we encountered were the sheer size of the project. It is a very large project. It encounters so many different disciplines and so many subspecialties. So you have orthopedics and vascular and plastics and medicine, endocrine, urology, and that. So you do have a whole wide range of people that you need to be involved. So trying to develop pre-printed order sets for that can be a challenge. Also then educating the sheer number of nurses and pharmacists and physicians is also a challenge. Along with that comes communication, developing the education plan, booking rooms, and so on. And then also the hiring and training of staff in order to do the education. Gathering the resources can also be challenging, and then there was some tweaking of the patient education pamphlet that we needed to do. Another challenge for many organizations is the dedicated resources, which often means money. And as we all know, budgets are very tight nowadays. Project lead, that was another challenge. I myself have never led a project of this size, so it was definitely a personal challenge for myself. Education-wise, again, getting the dedicated resources, I was very fortunate in order to secure an educational grant for a facility, which then provided the funds for hiring nurses to help with the in-servicing. Okay. Then also getting resources for data collection. Okay, and because this is a regional initiative, that in itself creates restrictions and guidelines that have to be followed that can be limiting to what you want to do within your own organization. Getting buy-in, again, always a challenge when it's a change. We also discovered that in our pre-printed order set that there was a human factor error that we had never anticipated happening, so we had to go back and revamp our pre-printed order set. Resident education, because we are a teaching facility, we find that trying to keep our residents all educated about VTE is very challenging because they turn over every so many weeks. And again, as I mentioned, resources, so time, human resources, and finances are definitely a challenge. Some of the successes that we have had, we were able to educate over 500 nurses in a 1-month period, so that was absolutely phenomenal. Most of our services now have pre-printed order sets with the necessary VTE risk assessment and prophylaxis orders, and we have been able to increase VTE awareness as well as increase our compliance. Okay. So some of the learnings for putting together such a program is have all your ducks in a row. So have all your data, do all your literature research using CHEST guidelines, NICE, Cochrane, nursing standards from various associations, and then also surveying other sites. If you can get work from other facilities without having to reinvent the wheel, do it. Senior leadership support, definitely something that you need. Physician leads and champions, all of us a benefit especially when you have physicians being able to talk to other physicians, it definitely helps. And again, also having your pharmacy champions, and then having dedicated resources, and not just promises of them, but actually having those resources. Okay. And again, from my perspective, having experienced project lead definitely helps so that you can have that team charter, having the overall implementation plan with deadlines, clearly assigned roles, and then assistance with identifying all the stakeholders, particularly when you're getting to the regional level. That is definitely a benefit. Communication, always very, very important. And then having the understanding that, you know what, there are going to be times where you're going to have to, just try something again. So, and then it always takes time. Change takes time. Okay. So some of the valuable resources, if you're just getting started in your VTE prophylaxis adventure, is the Agency for Healthcare Research and Quality has a fantastic document called Preventing Hospital-Acquired Venous Thromboembolism, and then also another document called Preventing Hospital-Acquired Venous Thromboembolism is also another one. It will take you through the steps of how to put together a team and how to get started on your project. Okay. Some other ones are also Safer Healthcare Now, IHI, and obviously and I spelled it wrong, the BC Patient Safety Quality Council is also very beneficial. Okay. So questions. Does anybody have any questions in regards to how we approached our education program? No? Okay.
Okay, so maybe we'll, thanks for that, Christine. That was great.
You're welcome.
I know that there was a problem with getting your slides to advance.
Yeah.
So hopefully people were able to follow along and could advance them themselves. If not, we will make sure that a recording of this call is available on our website afterwards, and you'll be able to download the slides from there as well. So if there, I see that there's one question that came in from Anne-Marie who asks, can you share your resources?
Okay, as I mentioned, I was able to secure an outside education grant, so that provided me with $19,000 worth of funds that I was able to hire 2 full-time nurses and 1 part-time nurse to help with the education, as well as provide me with the ability to provide snacks and so on and so forth. Pfizer was also helpful in providing the pre-filled deltaparin syringes as well as injection pads, posters, and other educational materials. So those were the main resources that I had tapped into as far as the actual education program. And then within Vancouver Coastal Health, we already have an existing online education program. So all I had to do was develop the slides and then send them to them, and then they uploaded them. So those were the resources.
What about the online module itself and pamphlet that you mentioned? Are you able to share those?
Yes, there definitely. If through yourself, Shari, we can definitely share those. Yeah.
Great. So maybe we can put possibly host them on our website or put a link there. And certainly after the call, maybe I will share your email address, if that's okay, with the participants here today, so that they can get in touch with you afterwards, and we'll be able to ask you some questions about that. Okay. There was another question that came from Lori. She asks, how many people did you have as dedicated?
Not as many as you'd think. So I led the literature search, gathering up all the information, started developing some pre-printed order sets, and then I was approached by the region, and then a regional committee was formed, but continued on at Providence Healthcare of leading the project within Providence Healthcare. And then, as I said, I was able to secure an outside educational grant for which I was able to hire additional nurses to help with the in-person in-servicing. So.
Right. And I also see a comment from Anne-Marie who says, in Ontario, we've used Discovery Campus, who could post and track education. Could we discuss this option for staff? Can I forward your email address to them?
Sure.
Okay. So after the call, when you logged on to WebEx, the system does collect email addresses of all the participants today, and so I'll be able to email everybody afterwards and put you directly in touch with Christine and Jennifer, if that's okay with you as well, and that way people could connect with you afterwards. Okay, so if there are no more questions for Christine, I'm going to pass it over to Jennifer, who can show us her system.
Hi, everybody. Can everybody hear me okay?
We can. Can you just do a quick test and go on to your slide number 2? I just want to make sure that it advances for everybody. There we go. Okay. Good.
Okay. As you know, I'll be talking today about Interior Health Education Plan for VTE, better known as the VTE Communication Plan. And the goals for the communication plan include promoting awareness of VTE prophylaxis through IH and making sure we're all on the same page. And then also our PPOs are currently being revised, which will also help get that consistent message out there about VTE prophylaxis. And then once the PPOs are approved, then we'll move to promote their use by clinicians. And we'll have a PPO implementation toolkit available for that. Here, maybe I'll just get my little pointer so I can do that. And we're trying to target our audience, target our message to anyone who might use the PPOs or be involved in caring for patients at risk for VTE. And just when Christine was talking, I realized I left a bit off here, but we've also developed a patient information brochure, which I'd forgotten about until she mentioned her brochure. So there's a few different ways we've used to get our message out, including IH newsletters. And these are just a few of the articles that have appeared in IH-wide email publications, and then more specifically targeted publications like Quality Quips. We've also communicated our message in person, informally, and then through more structured face-to-face presentations as well. We've also used our IH-wide website as a communication tool, so people can go there and find more information. And we've incorporated VTE into communication events that had a wider focus than just VTE. For example, here at Royal Inland Hospital, we hosted a patient safety room of horrors on Halloween for Canadian Patient Safety Week. And we shamelessly bribed people with prizes to take our patient safety quiz, which included questions on VTE as well as other topics like MedRec and stroke care. And then I wanted to show you the VTE online learning module that IH has developed for interior health. And I did that with the help of Dr. Bill Geertz and also a team of content reviewers within IH. And so far we've shared this module with 3 hospitals in Ontario and then most recently with Vancouver Island Health Authority. So that's been going pretty well. So now I just have to share my desktop, so I have to remember how to do this. Okay, so this is what our module looks like. And you can see here, this is our welcome page. The module covers a description of VTE, why appropriate prophylaxis is important and what it looks like, and then as well where IH is going with it next. And there's also sound on this, so I'm going to just turn my sound on so you can hear the next bit. So I'll just go on to this, what is VTE? Not sure what VTE is? Click the red circle to find out. I don't know if you can hear that or not, but that's my lovely voice. So here the module tries to convey this material in a more interactive way. So in this slide you can click on these red buttons. Pulmonary embolism, or PE, occurs when a piece of an abnormal blood clot in a deep vein breaks loose and travels in the bloodstream to the lungs. So then you can also click on the photos to enlarge it while you're listening to me chatting away at you. Also, we've included a patient story for people to click through from, you can see it goes from her decision to have surgery, and then getting a PE, and then a near miss, and then it's kind of how she felt about her ordeal. So then it moves on to risk factors, and then we have a slide on important questions. And then also you can hear that there's still text, or still audio and whatever. And then some of them even have video clips like this one. VTE is an important complication of hospitalizations. 60% of VTE cases are related to being a hospital inpatient. Among patients who develop a hospital-acquired VTE, only 35 to 50% are given thromboprophylaxis when they are in hospital. This represents a major missed opportunity to prevent such an important complication. Let's see, what else do we have? So we've got a little piece on Accreditation Canada, and then also the BC Ministry of Health mandate, and then it moves on into the 4 basic steps for preventing VTE in hospital patients. So you can go through the various steps, clicking through like this. If there's a little bit more, you slide down, that kind of thing. Then there's a slide with a call to action. So what can you do? And then there's a bit, another slide here that's a bit about what they can expect to hear or expect to see in interior health in the near future. And again, I've just turned the audio off, but track our progress, improvement, all of which will lead us to our goal of 100% appropriate prophylaxis for all patients at risk for VTE. And then, of course, there's a little quiz at the end, just like Christine. Here's the quiz I promised you. Good luck. It's next to get started. And the quiz is pretty interactive as well. So, for example, here, this one, it's you know, you join up the matching exercise, I guess. So here, I'll just do this one for you. I'll do it the right way. And then there's some feedback. Oh, I didn't do it right. And so if you make a mistake, then you get to redo it. It's pretty hard to make a mistake. You can see that even though I've made a mistake, it still 3 points out of 3 points. And I don't know, what else? I think that's about it. So I'll just, yeah, if you have any questions, I can answer them for you, hopefully. I don't know how to get back to the
very, very
oh, I go up here, don't I?
Yeah. Go up to the very top of your screen.
Yeah. And yeah, so any questions?
So I'm just having a look here for questions from the audience. That was fantastic, Jennifer. A really good overview of what you've developed. Some very innovative strategies there.
So it looks like some of what Christine has done is very similar to us. But I think one of the things that she did in more detail was having the in-service days with where they could try out that stuff, and I don't know that we've done that here at IH.
So other than the quiz then, Jennifer, do you, once they complete their quiz and get their certificate, is that pretty much it for education, or do they have an opportunity to do any face-to-face learning or to follow up with an educator at all?
Yeah, we've had, like I said before, I think it was here, so we had these face-to-face presentations as well. So, yeah, there's more, my involvement has been more with developing the online module, but there have also been face-to-face presentations. So either through an educator on the floor or also just with like a slideshow PowerPoint presentation to those people that might be involved.
Great. I did see a question come up here in the chat. A question from Lori asking, how are you auditing? Oh,
so you mean, well, so, we're looking through the charts, and, we, like most people, developed a baseline of data, and then we go through the charts. I'm not sure how regularly that's being done, to be honest, and then, yeah, and then that's rolled out in presentations and so on as well. Does that answer your question? Oh, who's doing the audit? The quality improvement team is doing the audits. So hopefully that answers your question now.
I wonder if the host could unmute Lori's line, just so if you have another question, Lori, you would be able to answer it. Lori, go ahead.
Oh, doesn't have audio.
Okay, she doesn't have audio. Okay, well, it's good that you...
Okay, I think there was another question about sharing for me, and I've already shared it with a few people, and we're happy to share it with anyone who would like the online module is what we've shared. So if you would like to have that and have a look at it, if I get everybody's email address or people who are interested, then I can send you a link to, we have like a Dropbox, online Dropbox for where you can pick up the files and have a look at it. So I know that, for example, VHA is taking it, and then where, it has IH, the IH logo and things, they're adding their own logo. You can get this was made in something called Articulate, and so you can get a trial version of Articulate and then make your changes and then to customize it for your health authority and then go from there if you want to.
Great. Lori was also wondering if she could have a sample of the audit tool, if you have one.
Oh, I don't see why not.
And for all the participants, number 2 in this series of webinars that we've hosted, was a great session that we did on auditing for VTE prophylaxis. And I know that that's sort of front and center for a lot of people right now in having to do some audits. So actually Dr. David Wilton was the presenter during that session. That session is now recorded and is available on our website. So I will show you the website afterwards, after the call today, and you'll be able to download and watch that on YouTube. Are there any other questions?
Sherry, I think I sent a question to the attendees instead of the participants. They're both education tools are really impressive. It's great work. I was wondering how much uptake they've had. Do they get feedback on how many people are taking the educational stuff online?
Is that a question for me?
Sure.
Yeah, so I, like Christine, I get I can request from my online LMS how many people have taken it, in fact, exactly who's taken it, and so on. So the uptake has been pretty good, but there's been about 90 people who have actually completed the whole thing, and then about twice that number have started the course but maybe not completed. And one of the reasons I think for that is because you have to look at, in order to be considered complete, you have to see every single screen you have to look at every screen in the course, and of course you may skip one slide along the way because you are too busy or you know that. So yeah.
How are you encouraging people to take it?
Through all those communication channels that I was talking about. So, so whenever there's one of those, a newsletter or whatever goes out, then there's a link to that online learning module as well. And of course, at the face-to-face presentations and so on.
Right.
As far as I know, because I don't do those presentations.
Within Providence, what we do to advertise it is on our opening website page is a PHC daily news, and in there we advertise on a regular basis that this is something that is available to staff. And then I go in on a regular basis and I can get a report as to who has completed the online module, when they completed it, what their score was, when they took the quiz, and so forth. And then I'm hoping to do another run of the in-person in-services this year as well as again, now that we've got a new pre-printed order set that have addressed the human factors errors, hoping to go out and sort of re-educate people about the pre-printed order set.
That's good.
I think we're coming up to that as well in IH with our new pre-printed orders are just in the midst. They're sort of halfway through being approved, and so once they are approved, then there'll be another push for some more education around that, yeah.
Okay. So I wonder if there's anyone on the call now that might want to share some of their own experiences in either challenges that they've faced in developing education modules, or perhaps they're just starting out and looking for some advice, or people that perhaps have already developed something within their own health authority. I'm going to briefly unmute the lines here. Is there anyone else who wants to share what they've come up with? Go ahead and speak now. Okay, no comments there. I'm going to remute everybody. And Lori was saying that she doesn't have anything on VTE and Fraser Health yet. So Lori and the rest of the people on the call today, hopefully this has been really helpful for you. And Jennifer, is it okay if I share your email address as well?
Yeah, sure, that would be fine.
Okay, so I'll do that after the call. You'll all get an email from me that puts you directly in touch with both Christine and Jennifer, so you can follow up with them and ask some questions. I'm going to go back now. if there aren't any other questions coming up, and just direct you to some great local quality improvement resources that we have. So one of our partners in improvement in British Columbia is Impact BC, and this is their website address. They've got some great tools to learn about quality improvement methodology. And additionally, on our website, clinicalcaremanagement.ca, if you're not familiar with this, this is where we talk about the measures and the audits for venous thromboembolism that are going on in our province now, as well as the provincial guidelines, meetings and events, and resources as well. And some of those resources include contact information, virtual learning sessions that are coming up, and the virtual learning sessions that we've completed and that have been recorded and are now available under that tab. So clinicalcaremanagement.ca. Just wondering, Dr. Wilton, did you have a question that you wanted to ask?
No, not for the group. I think I sent something to you. One of the things that, maybe I'll mention this, one of the things that we're thinking about doing at the council is getting people together that are involved on the operational side of implementing VTE on a regular basis, possibly in a monthly conference call, and having the opportunity to share resource materials and experiences in the province. So I guess my question for the group would be whether or not anybody would be interested in doing that, and if they'd find that to be sort of a useful resource. I see a check mark, probably by clicking a check mark by your name to show interest. We could chat down who might be interested, and if we do get this going, then we can contact you.
Great. So I see Maureen might be interested in helping us out or becoming more involved. So we'll definitely contact you afterwards, Maureen, and see if we can pull you into a small working group maybe. And a comment from Lori. She's a CNS and wondering if we're looking for managers and directors, or if clinical nurse specialists would be someone that would be helpful.
Yeah, I think that anybody that's involved on the implementation side would definitely be helpful. And anybody that thinks that in their role they could benefit from sharing their experience and learning from others, I think would be appropriate.
Great. When I contact everybody by email, maybe that's a good opportunity to sort of reply to me, and I can gather up those names of people who might be interested, and then we can take it from there. And thanks, Lori. I see that you're interested in taking part as well. So any last questions before we close up and say goodbye on this Valentine's Day? Okay, so I just wanted to thank you, both of our presenters, very, very much for sharing what they've done and what they've put together. Some really innovative and creative strategies that are in place in at least two of our health authorities. And I know that that there's definitely things that are happening in the other health authorities as well, maybe to a greater or lesser extent. It's just nice to know that people are really focused on educating health professionals. We've also got some patient education materials that we have put on our clinicalcaremanagement.ca resources, so you can contact me or have a look at our website and find some information there as well. And Maureen, I see a comment from you saying that you work in quality improvement and you'll be one of the auditors. So thank you for volunteering to get together with us and maybe take part in our working group. So I'm going to say goodbye. Thanks again to our presenters and for everybody for attending today. Enjoy the rest of your day. I hope you're all getting chocolate of some sort today on Valentine's Day. Thanks for coming. And if you sign up for our newsletter on our website, then you'll be informed of any future sessions. Thanks for coming, everyone.